Well, good morning, everybody. My name is Greg Valdivino. I'm the Director of Diversity and Inclusion here at the Greater Kansas City Chamber of Commerce, and we'd like to thank you for joining us this morning. This morning, we have two great presenters who will talk about the Safe Return Guide to Work. First up is, before I introduce our speakers, I want to just share a couple of housekeeping items. You will be on mute the entire time. If you have a question, and we strongly encourage questions, please use the chat function for the questions that you see there at the bottom of your screen. During the presentation, and Scott Hall is the Senior Vice President of Civic and Community Initiatives here at the Greater Kansas City Chamber of Commerce. And Carlos Gomez is the President and CEO of the Hispanic Chamber of Greater Kansas City. So with that, I'll turn the mic over to Scott and Carlos. Thank you. Carlos?
Yes, thank you, Greg, and thank you for everyone for taking time to be on here today. We want to thank the Greater Kansas City Chamber and Mark and the other partners, KC Rising, and the Civic Council for putting this together. This guide back to the workplace for safe return is essential. There's a lot of questions out there from not only small business owners, but from the general public. And so this really, I think, assists us to make sure everyone's safe. So we're glad to be a part of today's call, and thank you for everyone taking time to be here. Scott?
Thanks, Carlos, and a big thank you to each and every one of you for giving us some of your time today. It's great to meet some of you virtually. It's also great to see some familiar faces, folks that we've had the chance to work with for a long time at the Chamber. Before I start, I'm going to share my screen. I've got a short PowerPoint as I'm going to walk you through this document, but please feel free to, as I take you through a very high level of what is a 19-page pretty detailed in some cases document, please feel free to ask questions throughout. Greg, if you think there's a question that needs immediate attention from Carlos and me, feel free to interrupt at any time. I'm happy to take questions throughout the presentation, but we will have plenty of time for questions at the end as well. So I'm going to try and share my screen here, and as I do that, I will be sharing. Give me 1 second. Before maybe I share it, I do want to say a big thanks to Carlos and the Hispanic Chamber. As we were preparing this document at the KC Chamber, we knew we needed it to be translated into several languages, Spanish certainly chief among them. And we reached out to Carlos and his team, and they were able to very quickly get that translated for us. We now have the document translated into 3 languages, Spanish, English, and Vietnamese, and a big thanks to our friends at Sprint who helped us with the Vietnamese translation. There are other languages that we know we need to translate this document into in order to make sure that it's inclusive of all businesses throughout Greater Kansas City. We will be working on that in the coming days and weeks. But if you have someone that you know that has an urgent and immediate need to get this document into a different language, please reach out to us and we'll begin the steps to get that translation taken care of. So I'm going to wind you all back in time 8 weeks to when we all began to work remotely. And at the time we began to do that, the Chamber, the KC Chamber, and probably the Hispanic Chamber, and really all the chambers that we've talked to throughout the community went into a different kind of work strategy and a different kind of work type than I think any of us were really accustomed to doing. And that was sort of emergency assistance. And so we were working with our members, both healthcare providers, but also other essential workers in the very short, on their very immediate needs. Those immediate needs included childcare, food, housing, and for some of our healthcare workers, PPE, personal protective equipment, and other essential items they needed in order to address the surging number of COVID-19 patients they were facing. We were in that, what I'd call triage mode, for probably a good 3 to 4 weeks. while we were working with those local organizations, we were also having weekly telephone calls, which continue with our federal delegation. That's the offices of all the federally elected officials that make up the greater Kansas City metro area, and telling them what we were hearing from our membership was most needed in our community in real time. And I hope that chambers like ours, like the ones that are presented to you today, were influential in getting the PPP CARES Act and the PPP funds in their first round and then in their second round done and out. And Carlos and I were chatting before we started the call formally that both of our states, Kansas and Missouri for the metro, have seen a disproportionately high amount of PPP funds coming to local businesses. And that really is a testament to the incredibly hard work put forward by our financial institutions, those are banks, credit unions, and other financial institutions, but also to the people who actually had to apply for those PPP funds, business owners throughout the greater Kansas City metro area. Kansas, I believe, last we looked, was 9th per capita in PPP loan funds. Missouri was 13th. So we are well out punching our weight class with respect to both of those programs in both states in that program. That is essential to recovery. But as we began to get past that period of crisis management, we began to hear from our members and we began to hear from our healthcare systems that they were seeing a leveling off of the new admissions to the hospital for COVID. And the hospital systems were telling us, hey, when that happens, we need to get people back to work, both within the health systems and outside. And we began to hear from our members the stress they were feeling about not being able to operate in their workplace. And there are all kinds of members of the Hispanic Chamber. There are all kinds of members of the Greater Kansas City Chamber. But some of them really need their workplace to be open in order to be open for business. Some of us, less so. We're going to talk about that in a second. But we began, when we started hearing this feedback from our membership, thinking through, okay, how can we as a chamber and as a business and civic community work to reopen the workplace with the employee in mind, with the safety of the community in mind? And that really is what inspired us to help put together this plan. And I say help because we really did, in addition to the Hispanic Chamber, have a tremendous amount of collaboration around the drafting of this document. And you could see the 4 organizations, including the KC Chamber, who were the primary authors of the document: the Kansas City Area Development Council, the Civic Council of Greater Kansas City, and the Mid-America Regional Council. And we had a team of folks from each of these 4 organizations drafting day and night, vetting ideas with public health experts, with lawyers, and with other people that could give us good counsel on what ought to be included in the plan. And here you can see the first page of the English version of the plan and the Safe Return KC hashtag there. The document itself is 19 pages. I can't go through in the time we've got today in a tremendous amount of detail all the recommendations that are in the document, so I'm going to give you a 50,000-foot view. But certainly, as we do Q&A, we want to answer detailed questions to the extent they come up. Carlos and I both will be doing that. But also, to the extent there are questions that linger beyond today, we have some resources I'll close with that talk about how you can get all your questions answered. So as we began to think about a return to the workplace, we broke it down into 5 first steps, and we used action verbs around each of these: educate, listen, communicate, evaluate, and prepare. And each of these was very intentional, and they are all very community and employee focused. Educate is a directive to educate yourself on what other return to the workplace plans exist in your community, or in some cases, communities. And what I should say before I get into what this plan is what it is not. The Safe Return KC plan is not a set of rules or regulations that you must obey as you return to the workplace. we, the chambers of commerce and the civic organizations that put this together, we don't have governmental authority. We can't tell you you can't open until such a date, or that when you do open in phase one, you can only open to such a percentage. Instead, our thought and our approach to this document was, when you are able to open, as permitted by your local public health experts and your locally elected officials, what can you do as an employer? What can you do as an organization to keep the community safe and to keep your employees healthy? And that's really what this document's all about. And that's where you can educate yourself to begin with, is go look at the plan issued by your local public health department, by your locally elected officials, and understand what those deadlines are, what those guidelines are. This document should be very complementary to those guidelines. Once you've educated, we are urging everybody to listen. Listen to your employees. There is a great deal of fear about return to the workplace, and I'll actually address how you can mitigate some of that fear in a second. But one thing that we think is really advisable is to sit down with your employees, and for bigger organizations, it may not be able to be a one-on-one conversation, but if you've got a medium or small size business, it can be, and understand what stress are they feeling? What are their pain points around a return to the workplace? For some, they may be living with someone who's a vulnerable individual. For others, it may be childcare. And for some, it may be that they themselves are a vulnerable individual. And we'll talk about how to address some of those concerns in a second. Third is communicate. It's absolutely essential that as you craft your return to the workplace plan, that you communicate clearly with your employees and your community, your even customers, clients, and constituents about what your plan is, and even more specifically, how you're going to take steps to keep people safe. And again, going back to the listen phase, we know there's a tremendous amount of fear about a return to the workplace. And one of the things that we know employers and organizations can do in getting their customers, clients, and employees comfortable about a return to the workplace is to clearly communicate all the steps they're taking to mitigate the chance of COVID-19 spread in their workplace. So if it's shifted workers, if it's new cleaning regimens, if it's socially distanced workplaces or workstations, all of those things matter to your employees and to your customers and your clients as you consider how you're going to bring people back to your shared workspace. Fourth, evaluate. This is not, as you all well know, a static situation. Facts almost seem to change, I'd say daily, but it's more frequent than that. I mean, you all are probably like me. I'm consuming news in the morning, news during the lunch hour, and news at night. And there's usually something each of those 3 times that changes the way I perceive COVID and the pandemic and the way it might affect my workplace. Continue to do that as you contemplate your return to the workplace plan, and continue to evaluate the effectiveness of your own plan. We had Neil Sharma from DEG on when we first opened with this, and Neil, of course, is the CEO, and his message to about 750 people who were listening in when we first presented this is, don't let perfect be the enemy of the good. No one expects leaders from organizations to be 100% perfect as they contemplate and construct a return to the workplace plan. Be flexible. Evaluate, listen to your employees, listen to what the news is telling us around best practices. Certainly listen to what our local public health experts are saying. Evaluate and reevaluate your plan and make it something that's a living document, not just something that you create once and consider to be set in stone. And fifth, the fifth and final step before you bring people back to your workplace, and some of these things need to happen concurrently, is preparation. And that is a whole bunch of things. It's certainly educating, listening, communicating, and evaluating. It is also, though, acquiring PPE for your employees, your customers, and your clients. It's perhaps, in some cases, reconfiguring office equipment to ensure that people are at a safe distance if they're returning to the workspace. And it's probably, in almost every case I can think of, going through the office with some kind of cleaning protocol and making sure that as people return to the shared workspace, that they're coming back to a clean and safe facility. So we set our guide out in 3 phases. And these 3 phases and the names of them track the CDC White House task force led by Drs. Birx and Fauci and their phasing. So phase 1 is minimal reopening, phase 2 reopening with physical distancing, and phase 3 is resumed to normal. Now, the names of these phases are, honestly, they're a little bit misleading. Phase 1 should probably be titled a very careful reopening or a very careful return to the workspace. You will see in the document, we still contemplate a tremendous amount of social distancing as a best practice when you're bringing people back to the workplace. 6 feet of distance, sometimes even greater than that, very limited use of common areas, if they're even being used at all, no external meetings or no external visitors to the extent that can be done in your workplace. Those are some of the guidelines you see in the minimal reopening. But I will tell you the one that we keep coming back to. And it's different for every employer, but it's this general rule. If someone does not have to return to the workspace, to the shared workspace, to be effective in doing their job, we're suggesting in phase 1, they not be returned to the physical workspace. And again, that's a judgment call that every CEO, every executive director, every business leader has to make based on the circumstances that surround their own workspace. But even as recently as this morning, the KC Chamber leadership team were talking about what we're hearing from public health experts, and that message continues to resonate. Now, for client-facing, public-facing organizations, retail is one that comes to mind, hotels is one that comes to mind, that is nearly impossible. And so we recognize that not everyone can work remotely and continue to do their work. But for many of us who work in an office setting, KC Chamber, for example, we know that it's not absolutely essential that everyone be in the shared physical workspace in order for their work to be done and done well. And so we ourselves are not returning people to our shared workspace until at the very earliest June 1st. That's longer, of course, as you all well know, than the guidelines set forth by the city of Kansas City, Missouri. And even then, we're going to be very careful about who, when, and how we return people to the workplace to try and ensure social distancing during this phase 1 phase as much as we can. Phase 2, reopening with physical distancing, is still pretty extensive in the recommendations made around preserving social distancing. This is a moment in time when we know and acknowledge that there is a reduced risk of COVID-19 transmission in and among the workplace, but still that it's very real. And what you'll see, especially in phase 1 and phase 2, is an emphasis on what you can be doing, protocols and practices, in case someone in your workspace contracts COVID-19. And that's really important. And we suggest protocols which include having employees take their own temperature at the beginning and end of each day. The reason for that, without getting into too much granular detail, is we learned from our public health experts, everyone's temperature is lower in the morning. So you may not present a fever when you wake up, but you might actually have a fever. And if you measure it at the end of the workday, you'll know. We also suggest that people take the temperatures of their employees as they return to the workplace. And even since we issued the guidelines, we have been reading polling that says most people are actually quite comfortable with that. They don't feel that's an intrusion of their privacy. That won't be the case for everybody, but taking the temperature of employees as they come into the shared workspace is something that most people are comfortable with given the times we're living in right now. Finally, I want to move quickly to phase 3. And I just want to mention that this is the one with what I think is the most misleading name. I would not have named phase 3 resume to normal, because you will see there are still social distancing practices that we suggest during phase 3. And I think resume to normal may give the false impression that this is resumption of activity as it was before COVID-19. And it is very much not that. You still need to be tracking very carefully, does anyone in your workplace have COVID? If they do, you need to take immediate steps to remove them from the workplace. but also, does anyone in your workplace live with someone who has COVID? And if so, they need to be quarantined, even in phase 3. Phase 3 contemplates that there will not be many cases of COVID left in the community, but it doesn't necessarily contemplate that the virus is completely gone. And so be careful as you think through getting to phase 3. That's not really business as usual. That terminology is probably a little bit misleading. So each of the guidelines you'll see has recommendations around these 6 areas: employees, general workplaces, workplace guidelines, meeting rooms, common spaces, travel, and employee assistance. And you can read them for yourselves, but the one I really want to highlight is the last one. It's employee assistance, because it's really important as we get to the later phases of the return to the workplace. We believe, based on the due diligence we've done and the conversations we've had with public health and employee health experts, that the stress of COVID-19 is going to be very real for many in your workplace. And it's going to be the stress of being at home. It's going to be the stress of fear around contracting the virus, the stress and fear around loved ones contracting the virus. And we think, you know, the human condition is to be pretty resilient, but stress builds. And so as you're returning people to the workplace, the recommendation around employee assistance is very brief in the document, but we really are urging everyone to reach out to their employees, especially as you get to phase 3 and more people are returned to the shared workspace. Ask employees about how they're feeling. And I know that seems very sort of new age and touchy and feely, but it's real. People are going to carry the stress of this pandemic back to the workplace with them. And we believe that if you're working closely, communicating closely with your employees, and you can, as a manager, as a business leader, better sense where people are feeling this stress, you'll be able to return them to the workplace more successfully. Finally, as I mentioned, we can't get into all of the fine details around all the different kinds of members that Carlos and the KC Chamber have in our ranks. And so we've added links at the end of this document to our webpage and to the webpage of the 4 civic organizations that drafted this document, that have additional back to the workplace plans that can provide additional detail, additional inspiration, and certainly to the extent these documents are provided by our local public health organizations and elected officials, we will provide links to all of those documents so that you can know what the provisions are that impact your workplace or workplaces and can help you reopen. Also, we couldn't get into the granular detail that some trade associations that are industry specific could. Hotels, restaurants, manufacturers are among those types of business organizations that have really specific recommendations about how to return to the workplace safely. You'll find links to some of those documents at the end. We would urge, if you are in one of those kinds of industries, to refer also to those trade association plans, because they can be really helpful. And then finally, to answer any other question that comes up, the KC Chamber is standing up the KC Chamber Small Business Hotline. And you can see the number and the email address there. If anyone is joining us by phone and not by screen, I will tell you the number is 816-374-5440. And the email address is helpdesk@kcchamber.com. And we can answer lots of questions on that small business hotline. But I will fully admit to you, there are questions that we cannot answer. We are not trained, or we are not skilled enough to answer some of those questions. If we can't answer the question, we will find you someone who can, including linking you up with a legal resource or a healthcare expert who can answer those kinds of specific questions for you. And that's really it. That's the document. And I want to make sure that we have plenty of time for questions. So fire away, Carlos. Do we have any questions coming up?
Yes, I have a few. And Scott, one thing I wanted to point out was that hotline, someone that speaks Spanish can call. They can get assistance as well.
That's absolutely right. Thank you, Carlos. That's great.
So I wanted to point that out. Yes. Here's the first question. A lot of businesses right now, one of the questions they have is when other businesses are going to open, a common question has been, which ordinance do I follow? Do I follow the city? Do I follow the county? Do I follow the state? Which one takes precedent?
Yeah, that's a great question, and I'm going to give very careful legal advice to everybody. The first bit of that is, if you really have a question specific to this, you ought to check with legal counsel. And as I said, we can put you in touch with lots of legal counsel who are members of the Hispanic Chamber or the Casey Chamber to help answer some of these questions. But I will tell you, we've worked enough in the public health space, we know how this generally works. The states issue their guidelines. Under both Kansas and Missouri law, local political subdivisions are empowered to pass more restrictive guidelines than the states. They cannot pass less restrictive guidelines than the states, but they can pass more restrictive guidelines than the states. And frankly, that's what you're seeing in both Kansas and Missouri. Governors Parsons and Kelly have set parameters for the state's reopening plans, but they leave out a lot of specificity. Then what you see in Kansas, for example, is Johnson and Wyandotte County each have their own back return to workplace guidelines. If you're in those two counties, follow those guidelines because they will be as restrictive as the governor's guidelines and even take it a step further. And if you follow the county's guidelines, you'll be in compliance with the law. Now, in Missouri, it's a little bit more complicated in this. The city of Kansas City, Missouri is a city that resides in multiple counties, as you all probably well know. The city of Kansas City has its own public health department. If you are talking about a facility within the city limits of Kansas City, Missouri, the KCMO guidelines are the ones to be followed. If you're talking about a facility that's in Jackson, Clay, Platte, that's outside the city of Kansas City, Missouri, then each of those counties has guidelines that you can follow that are the ones to be following there. And again, in Missouri, each of the local public health guidelines are more restrictive than what the governor has put forward, and so those are the places you should refer. Now, where this gets tricky, for those of you that have operations in multiple jurisdictions, this is tough, and I can't say that we know with absolute clarity what to do. The guidelines are meant to impact the facility themselves, so the location. Where Irene's located is, where her operations are, each particular facility should be governed by the laws of the political subdivision in which that location is located. Now, the one exception I will tell you that we believe exists to that rule is, Irene, if you have a facility on the Kansas side and under Wyandotte County or Johnson County governmental guidelines, it can reopen on a certain date. If there, though, was an employee you had who lived in Kansas City, Missouri, and the Kansas City, Missouri guidelines said that employee could not be compelled to work, you probably cannot compel that person to come back to the workplace. Again, I don't think that's going to be a huge issue. Most of the member organizations we're seeing are being pretty compassionate about people's fears to return to the workplace. And so they're not compelling at this moment people come back to the workplace. Some of that will happen, we know, as this lingers on, but be very mindful of that fact. If you have someone that lives in a different political subdivision, if we move back into more restrictive stay-at-home orders, that may impact their ability to come into the workplace. Sorry, Carlos, that's a long answer to a short question, but I hope that's helpful.
No, that was very helpful.
This issue in particular is really tricky.
You've helped me because we've been getting that question here. We have entities with multiple locations, and
yeah,
that's going to help me answer that.
Yeah.
Here's another question: what kinds of questions are okay to ask an employee, and what kinds of questions are not okay to ask an employee?
Yeah, this is really important. Everybody needs to be really careful about how they proceed on this. In the guide, under the Listen tab in the opening part of the guide, we talk about this a little bit. And the wording we used in the guide is very important. So I would urge you all to check out that section of the guide and use the wording that's in there very precisely. You can ask an employee if they are a vulnerable employee as determined by the CDC. Okay, you are perfectly within your rights as an employer to ask that question, but you can only ask it as a yes or no question. If the answer is yes, you cannot ask someone why. So let's say, for example, Irene was interviewing in a place. Sorry, Irene, I know you, I love you, so I'm going to pick on you a little bit. Thank you. If Irene had an employee on staff and she asked everybody on her staff, are you a vulnerable employee? And the definition for vulnerable employee includes living with someone who is a vulnerable individual. So it's broader than you might think. If she said, are you a vulnerable employee or a vulnerable individual? And they said yes, she can't ask, what part of the CDC criteria makes you a vulnerable employee or individual? That is seen as being a violation of, I don't know if it's HIPAA or employment. You subject yourself to liability around employment discrimination claims. The other thing you cannot do is you cannot discriminate in your return to work plan based on criteria, even if you know someone is a vulnerable employee. So for example, you cannot have a return to the workplace plan that contemplates that employees under the age of 65 can return to the workplace before those over the age of 65 can. You will subject yourself to potential employment discrimination liability based on age. Any other protected class would be exactly the same way. And so what we are urging people to do is, as they're thinking through their return to the workplace plan, be very careful how you ask the questions. Ask them, keep the information completely out of someone's personnel file. And one best practice may even be to have someone who is not your HR representative ask that question so that there is no concern that it's in an informal HR file. You don't have to have an HR representative ask about whether or not someone's a vulnerable employee. So take a look at the very careful language we've put also in the first bullet of each of the 3 sections. And that language includes very specific things you can say to people who are over the age of 65 about their risk in returning to the workplace. But it does not say you can discriminate in bringing them back to the workplace based on their age. It just alerts them to the added risks that they are subject to by returning to a shared workspace.
Scott, if someone, if an employer or a director of an organization gets a call from an employee saying they tested positive, what should they do, and what questions can they ask?
Yeah, that's a great question. So,
and it further asks, can they ask for proof?
Ooh, that's a good question. I don't know the answer to that, Carlos. We'll find out. I know they can ask for proof of clearance if they have tested positive. I know they can ask for proof in the form of clearance from a medical professional before they return to the workplace. And we urge in the document that that be achieved. I don't know if an employer can ask for proof. I don't see why they couldn't, but we'll track that down. That's a great question. To the broader issue about what do you do if someone calls you and says they've tested positive? Well, the first thing you do is keep that person out of the workplace, right? That's the easy thing to do, right? Don't let them come in at all, period. The next thing you should do is, and we say this throughout the document, to the extent that person has been in your workspace, we are urging everybody to be smart and keep records of where people are. If people are in a shared conference room together, have them log that. Have them log the times that they come into the workspace. And sorry, I just got a note that the electrician is coming back today. This is the work-life integration we're all suffering through. So keep a log of when people are sharing conference rooms with one another. Keep a log on when guests return to your shared workspace, who those guests are, when they have come in, and who they have met with in your own organization. And I would say anyone who has come in close physical proximity to anyone in the workspace who has tested positive should be alerted immediately. And a best practice, I think, as determined by most of the public health experts, would be to have those people isolated home. Anyone who has come in touch with someone who's tested positive over the previous at least 3 and probably best practice is 7 to 14 days should isolate at home for a period of time. The recommendation is generally 14 days of isolation.
Awesome. The next question is, I'm not a first responder. Where can I get masks and Lysol? They're having a hard time finding to get sanitation.
Yeah, that's a great question. We've got some resources up on the Chamber's COVID-19 resource page that will tell you where you can get cleaning equipment, where you can get PPE, and where you can get any other of those critical resources needed in order to reopen. What I will tell you is getting some of those things is actually not a challenge right now. It's actually easier than you might think. Getting some other of those things, testing in particular, it's just not there yet. So if you're talking about where can I get my people tested before I return to the workplace, I will tell you we do not have testing abundant enough in the city, in the greater Kansas City metro to test everyone who is returning to the workplace. We just don't have it. And it will be some time, we think, before that happens. So we're not making it a requirement that everyone get tested before they return to the workplace, but anyone certainly who shows symptoms should be tested immediately. And they should be working remotely immediately upon showing those symptoms. All of those resources are available on the Chamber's website, which can be linked at the end of the document. And with respect to some of the disinfectant cleaning equipment, people we believe are having a pretty easy time getting some of those things. Masks are becoming more available. And one thing I think that's really important for everyone to know, most of us, Chamber included, Melanie and the rest of the KC Chamber team and I, we do not need N95 masks to go back to the workplace. Most people can use a cloth mask. Those cloth masks are now being mass produced by a number of Chamber members, Hispanic Chamber members, I'm sure, and they're fairly easy to get at this moment.
I would also like to add, Scott, that the city of KCMO on their city webpage has a list of local businesses that are providing PPE, and they're from the whole reach in the metro. So if anyone out there is producing PPE, you can notify the city of KCMO and get your business listed, as well as if you know any businesses, make them aware to get themselves listed with the Chamber as well as with the city of KCMO, because that's where we've been referring people. Any other questions out there? Let's see. Yeah, there's people are making recommendations of where they've gotten some nice masks. Thank you. What we'll do is forward those. If you have any great links, let us put them on here so we can forward them out to everybody and put them on these websites. More importantly, if they're local, let us know if they're local businesses so we can get as many local businesses to help. A lot of businesses have pivoted. I was just with a member in Wyandotte yesterday, a Latina-owned business, and she has a company called T-Shirts for You on 18th Street, and she has pivoted to making masks and all kinds. So yeah, please let us know where those sites, those companies are throughout the metro. Okay, here's another question. Let's see. What kinds of experts were consulted on drafting of this guide?
Yeah, great question. So we conferred with several different local public health departments. We conferred with several different local public health systems, including the University of Kansas, which I think at least through most of this has been seeing the greatest number of COVID-19 patients, along with the HCA system in St. Luke's. And then we conferred with HR and legal experts as well with respect to some of the return to the workplace legal issues.
Awesome. Awesome. Any other questions? While I'm looking here, if anybody's, one thing I want to commend the Greater Chamber, there's actually been people around the country, I understand, have been contacting you. How many people have utilized the service so far? Have you guys been tracking numbers?
Yeah, we think there have been over 4,000 unique uses of the Return Safe KC Guide. Cool thing for us, we learned last Friday morning that the guide itself had actually been presented in a briefing last Thursday to the governor of New Jersey. I, I don't know how that really happened, but we were early out of the gate on this. We beat most of the political subdivisions and jurisdictions, and we were hopeful that this would serve as a roadmap for others to use as well. And certainly in the last 2 weeks since we introduced the document, there have been a number of these that have come out, some of which are really good. And frankly, there are a couple times when we've read it, said, man, I wish we would have thought of that one. And I will say to that point, we are going to continue to update the document. The drafting team met Friday of last week. We have a couple of notes we're going to add to the next version of the document, but we didn't want to confuse everybody by introducing another thing right now in this moment. We think there's so much new information coming at people that might overwhelm them. But at some point, we will do a version 2.0 of this document with some new information, new reflections. Hopefully, it's even better guidance for everybody as we go forward.
Awesome. I just want to make, so we don't have any more questions. If anyone has any more questions, please send them right now. But I just want to commend the leadership that you all have done, because this guide has helped. We have already started to distribute it. And if anyone on this call, if you know of a small business, please, they're printable in English and Spanish and Vietnamese. We really want to thank Sprint for doing the Vietnamese. 80% of nail salons are Vietnamese owned, and there's 500 nail salons in the Kansas City metro. And people just have questions. Business owners want to make sure their employees are safe, customers are safe. Scott, I'm not sure if you can answer this question, but I've had someone ask, can I refuse someone from coming in that is not wearing a mask? I think that might determine upon the area they're in. Like a customer. I think
yeah, right. I'm trying to think. That is an issue that has come to a head since we issued the guide. The answer is it probably depends on where you're talking about. Mm-hmm. I know there's an ongoing debate right now. I do not know.
I don't know that answer. So like you said, there's a lot of answers.
Yeah. I don't know across the jurisdictions, counties and the states, where they sit on having a law doing that. The short answer, we'll check it. We'll see if we can find an answer to that.
I'll ask one of our attorney members too, because that's a tough one.
Yeah.
I think the city of KCMO, they have said, as far as barbershops and nail salons, they can refuse. But that was the city of KCMO.
Most businesses have the right to refuse service to anybody they want to refuse service to. Now, you can't refuse on certain grounds, right? You can't refuse because somebody doesn't look like you or somebody's too old, or but you can refuse not to serve somebody who's not wearing a shirt, for example, or shoes. We've all heard the no shirt, no shoes, no service. I would bet, again, without giving legal advice, I would bet you could probably do that in both Kansas and Missouri as it stands right now. Now, the legislatures are still in session, and there are some conservative legislators out there that might feel that rule needs to be changed. So I hesitate to give you that advice because it could change, and it could change quickly. But
we'll check too.
Yeah.
These are the questions that come up. I just want to talk to everyone on this call. There's still $120 billion in the PPP, the Paycheck Protection Program. So we want to bring as much of that money to Kansas City. So if you know a business that has not applied for the PPP, I talked to one yesterday and they said, well, that's just too much work. I don't know if I want to do it. I said, at least look at it.
Yeah.
Have you looked at it? And they said, no. I go, let us sit down, let's look at it, and then know what you're saying no to. And because it's been very helpful to a lot of businesses. That being said, you got to follow it to a T, otherwise it's a loan and it's not going to be forgivable. Please, if everyone could get the word out, there's $120 billion as of last Friday still in the PPP. On the EIDL loan, if someone, at the very beginning, there was a safety security breach. So people who applied for the EIDL, if they got a 3 on their confirmation number, they were in queue. If they got a 2, they were in the breach and they were told to reapply. Well, right now you can only reapply if you're ag. As of last Thursday, the SBA is allowing those 2 to reapply under the ag, but they have to say that they were a 2, put the approval number, and they will be processed. There was a lot of frustration that a lot of business owners said, I did everything right, and the SBA had a security breach, and I got kicked. Why did I get kicked out? The SBA is now taking care of all those people. So if you know of a business that said they don't know where their EIDL loan is or their PPP, please have them contact the SBA or the bank or the Greater Chamber or us. And there is no more questions. There's a shout out to, I want to say this right, Statuette Stitching, which is a local business that's providing quality masks and PPP. So, and then I would also want to say in Wyandotte County, T-shirts for you on 18th Street, Latino-owned business. They're making masks as well. So there's a lot of local companies that we could help and help the community at the same time. Scott, Greg, I'll hand it back to you because there's no more questions.
Great. Carlos, thank you. And I want to echo the thanks to everybody for giving us some of your time today and really for all the incredible work you're doing. This is a return to the workplace plan. It's not a return to work plan. We're all working. I know, I can tell. I know you guys are working. I know we are working. As we think through ways to come back safely to the physical workspace, our success in doing that will ultimately save lives and it will benefit business. And there is, you all may have seen the article and they talk about the hammer and the dance and we're walking a tightrope here, balancing reopening the economy with keeping people safe. And frankly, the more thoughtful we do it, the more successful we'll be. And so I want to thank each and all of you for the work you're doing and for Carlos, the work he's doing. And please let us know, either chamber, if there's any way we can be helpful as you try and walk that tightrope. Greg?
Thank you, gentlemen. Fantastic information that you guys just shared. And we want to let everybody know that this webinar was recorded. So we urge you, and it will be sent to you maybe in a day or two, and we urge you to send this to anyone who might find this beneficial. And at this moment, I think everyone can find the benefit of hearing this webinar as well as reading the guide. So with that, we want to thank everybody. We're going to let you out about 8 minutes early. Don't you just love that? And be safe out there, and please look out for our follow-up email. Thanks again to Carlos and the Hispanic Chamber of Commerce. You guys are doing some fantastic work, and it's a pleasure to partner with you guys. And of course, thank you, Scott, for all the work that the team put in putting this guide together. So with that, have a great Wednesday, and we'll talk to you soon. Thank you.
Thank you.
Thank you all.